Dear Humboldt County residents, I want to let you know that I'm resigning from my position as the health officer for Humboldt County. This has been an incredibly difficult decision, but while it has been a privilege to work with this county's talented and dedicated public health and emergency operations center teams, the emergence of COVID-19 and the response it requires has changed the health officer position from the very part-time one I stepped into back in late January to one which is more than full-time. It has also become clear that this level of commitment will be needed for the duration of the event. I was happy to accommodate this need in order to help the county swiftly respond to the pandemic at the outset, but now I need to make good on some promises to my family. Over the past 7 months, Public Health, the Emergency Operations Center team, and community partners have built expansive new infrastructure to respond to COVID-19. There is markedly improved access to testing in Humboldt County, with our internal lab now able to run over 200 specimens per day, in addition to our Optum site, an alternate care facility which will be used by our hospital partners in the event of a surge, robust and expanded contact tracing capacity, and a congregate setting task force that has worked to help long-term care facilities protect the most vulnerable in our county. Through the Joint Information Center, we have provided ongoing education and information to the residents of Humboldt County so that everyone is empowered to become an active partner in efforts to control the spread of COVID-19 locally. The JIC has also been central to the business plan review process, which has helped local employers develop a safer workplace for their staff and their customers, benefiting the entire county. The EOC has been well designed to expand or contract as the pandemic requires. Still, there's work to be done to ensure we are well positioned to minimize serious illness and loss of life in our community in this ever-changing landscape. Recently, new challenges to testing access have emerged as the state contract with Optum is slated to expire at the end of the month. We have been exploring all options in the search for more responsive testing capacity. A new alternative being planned through an innovative regional partnership should bring ample and accessible testing to all residents of Humboldt and Del Norte counties, including tribal communities. This will be an enormous asset for our county, and it would not have been possible without the vision and hard work of this team. COVID-19 response in some form is likely to be needed throughout much of 2021. As I am unable to continue in this full-time position for that duration, it makes sense to plan for a replacement at a time when we are in a fairly stable position and not in the middle of a surge in activity. It has been a pleasure working with Director Stevens, Dr. Ennis, and everyone involved in this massive undertaking. I am proud every day I walk into this building and the EOC. I am grateful for the opportunity I've had to witness firsthand the integrity and commitment of an amazing team, and for the incredible support of many of our elected officials and community members who embody the best of what drew me back to Humboldt. To the many who have written cards, letters, and emails to voice their support of me and the entire COVID-19 response team, I want to say thank you. Your kind words and your efforts to keep Humboldt residents safer have energized all of us in public health and the EOC during this challenging time. I believe a candidate with the leadership skills and expertise needed to continue this work will step forward to help navigate Humboldt through the next phase of response. The plan is for me to continue to serve Humboldt County in a part-time capacity under the new health officer and the deputy health officer, Dr. Ennis, to provide whatever assistance I can for the community going forward. Humboldt is my home. Thank you.
Thank you, Dr. Frankovich. So we'll move on to questions from local media for the September 2nd media availability. The North Coast Journal asks, you were the focus of some especially vitriolic public comments at yesterday's Board of Supervisors meeting. Can you speak to what role, if any, such comments from and exchanges with members of the public, as well as local appointed and elected officials, played in your decision to retire?
Well, certainly it is not pleasant to listen to that nature of comments, and I think, I certainly am supportive of civil discourse, and we have not always had that. However, no bully at a meeting is going to make me leave this position. It really is a decision that's based on family need and looking at the projected term of this event and the time needed to meet the response. That's it.
The North Coast Journal asks, have you felt supported in your role as health officer by county staff, the sheriff, local police chiefs, and the Board of Supervisors?
I would say that overall, this is a difficult landscape for everyone to navigate in their respective roles, and I understand that. And I feel that, again, overall, I have gotten very good support, and I appreciate that.
The North Coast Journal asks, can you describe the toll this job has taken on you and your family, both insofar as its demands on your time and the way it has thrust you into the spotlight as a public figure?
Well, yes, as I think I've commented before, people who go into public health are not usually looking for a spotlight. So that has been challenging for sure. And I've certainly, though, appreciated the ability because of the JIC to communicate frequently with the public and to help convey sort of the nuances of this, which are challenging for all of us. So it's just really, in part, I'm 60, my husband's 70, I have an aging parent, and there are things I need to do that really are difficult to do when you're working more than full-time in a position, like responding to COVID.
The North Coast Journal and North Coast News ask, do you have anyone you would recommend the Board of Supervisors look toward to becoming Humboldt County's next health officer?
Well, I happen to know that there are a lot of talented physicians in this community, and I would certainly welcome any of them to step forward and take this on, knowing that Dr. Ennis and I will be there to help support the work that they do.
The North Coast Journal asks, what advice would you give whoever succeeds you in the role?
Well, that's challenging. I haven't thought about it in that way. Certainly I think, it's someone who is able to work well as a team, as part of a team, and feels comfortable in a leadership role in a team. But, the landscape is ever changing with COVID. So I think that ability to adapt and move forward and eagerness to read and understand what's going on would be helpful. And but I think in general, it's just really comes down to someone who wants to serve the community.
The North Coast Journal asks, when long removed from your time as Humboldt County's health officer, what do you think you will be most proud and regretful of during this period?
Well, honestly, I think the thing I'm most proud of is both sort of as I mentioned at the outset, the amazing team that I've had the privilege to work with and the work that they've done, as well as the community. I think that sometimes the voices of dissent are loud and get a fair share of the spotlight, but I can certainly speak to the many, many people who have reached out to me personally and to our staff and in their support. And I completely appreciate that. It's been a pleasure.
The North Coast Journal asks, understanding you intend to remain on under the new health officer in some capacity, what are you most looking forward to doing after relinquishing the title and full-time duties of the job?
So again, my intent is to be part of this response ongoing, but in a part-time capacity. So in my free hours, honestly, I just can't even quite imagine. I'll put some thought into that.
The Redwood News asks, in your resignation, you mentioned that you plan to serve the county in a part-time position under the new health officer and Dr. Ennis. For the time being, will Dr. Ennis be stepping into sort of acting health officer role? And can you give us a better idea of what this new part-time position will look like for you?
So first of all, I just want to be really clear. I remain the health officer, and I will until we recruit someone into this position. And I will work with, at that point, I will work with the new health officer on transitioning and then continuing to support that role.
Redwood News asks, what is going to happen to the media availability slots? Dr. Frankovich is featured in a large number of those, and with her resignation, will public health have someone else fill in? Will the number of media availability videos each week decrease? Who will now be that driving voice informing the community coming from public health and the JIC now?
Well, I would say that for those of you who are tired of hearing from me, you're going to be disappointed because that voice will still be me until we have a new health officer. And then I would imagine from time to time, even under a new health officer, I might be speaking with the media. But it is me, and I will remain in that position and make sure people have the information they need.
Reporter Daniel Mentz asks, health officers in other parts of the state and the country have reported that they've been the targets of threats, including death threats. Some resentment about your orders has been expressed in Humboldt County. Have you received threats, and if so, what types?
I'm not personally receiving threats. If they exist on social media, I'm not aware of it.
Reporter Daniel Mentz asks, you have, in your words, been subjected to insinuations of racism. Did the public airing of your disagreement with HSU's president and the subsequent controversy contribute to your decision to resign in any way?
You know, it did not. It was disheartening, as I mentioned at the time, but no.
The Times-Standard asks, what spurred this resignation? Can you provide an explanation for why you need to go part-time?
Well, I think we sort of talked about that in terms of family needs.
The Times-Standard asks, if a surge were to take place this fall, how would that be handled if there is no permanent head of county's health department?
So again, I just want to point out, I will remain the health officer, and I will do so while we are recruiting for a new health officer, and then we'll be staying on after that. So I don't anticipate us being without someone in the leadership role.
The North Coast News asks, you started this job shortly before the pandemic reached Humboldt with its first case. What were your expectations for the role, and how different was it than expected?
It's a good question, and you know, I may have mentioned along the way that having gone through H1N1 in my previous work in Michigan as a health officer, it was very different from COVID, and a lot of what we did at that time was to implement policy that was well developed and formed, and there was not a lot of shift over the course of the event. This has been completely different in that everyone has been learning about this virus at the same time. It is not an influenza virus as H1N1 was. And so I think just the enormity of the challenge of keeping up pace with research, what's coming out, and how we need to adapt and flex, and that happening at the national, state, and local level at the same time. So I think it's been very demanding, but it's also been fascinating as we've moved through this.
The North Coast News asks, there has been so much support and also some criticism of how things have been handled. How much sleep have you lost trying to make decisions to keep our community safe?
Sleep is difficult, I have to say, on some nights. And I think, in general, I think I've been really fortunate to have peers that I work with and the state as an excellent resource to be able to navigate much of what we've been doing. And so, but I think, obviously, as we move through this, there are consequences to all the decisions we make. So when we protect the public health in one way, we may have to compromise it in another way, or may not anticipate what that is. We know that people's health is determined not only by infectious disease, but also by things like employment and being able to access food and emotional support. And so again, everything we do has a consequence, and yes, that weighs heavily, but I feel fortunate to have the support I have had in making those decisions.
The North Coast News asks, when will your resignation be effective, and what's the first thing you plan to do once you move out of the full-time role?
So, again, I remain as health officer while the recruitment period occurs. And so I don't know when it will be final, but the community, of course, will be kept informed of the process, and we'll move forward then. When I move out of the full-time role into part-time, again, I'll give it some thought. There hasn't been time.
The Lost Coast Outpost says, Dr. Frankovich, thank you for your service to the county, and asks, local public health officers throughout the country have been subjected to intense political pressure for their efforts to manage the pandemic. Have there been any times during this crisis when you felt as though you didn't have support from elected officials or from particular elected officials from the public?
Well, overwhelmingly, I've felt supported. Obviously, there are moments where you do not. And obviously, there are some strain points and disagreements that occur along the way. I think the hardest thing for me in response has simply been the way that politics have intruded into science and trying to navigate that using the best information we have to move our community forward through this, but having to do so in an era that has become rather divisive. And so I think a more cohesive approach benefits all of us in our local community and across the country. And so I'm hoping that somewhere in the course of this pandemic, we find that balance.
The West Coast Outpost asks, during yesterday's Board of Supervisors meeting, regular public commenter Kent Sawatsky mocked your name, accused you of literally killing people, and said he wished you'd leave. Can you talk about the personal impact of being the face of the county's pandemic response, and did that pressure contribute to your decision to resign?
Again, obviously it's not pleasant, and I would much more appreciate good civil discourse where we can disagree with each other, but do so civilly and understand that that doesn't make us enemies. That being said, no, it did not influence my decision to resign.
The HSU Lumberjack asks, as you know, a series of emails were released showing you and Tom Jackson going back and forth about whether HSU's reopening to students was a good idea or not. Due to the attention received by said dispute, was there any relation from that to your resignation?
I believe we answered that no.
The Redwood News asks, are you able to confirm that an employee at Winco Foods in Eureka has tested positive, and any information you can share about the situation that would be beneficial for residents that may have shopped there recently? As the pandemic progresses, can you explain how public health decides when or how to alert the public to cases at certain workplaces, for example, grocery stores, gas stations, restaurants, etc.?
Sure. So what I can say is that overall, as I'm sure people have recognized, public health is not talking about cases specific to employment places unless there is a direct public impact that we need to address. So for instance, if there is a concern about an extensive interaction or the nature of the situation where we feel there have actually been close contacts and we can't identify who those people are, that's when we really move forward into the public and ask for people to self-identify. When we have instances, as is often the case in many of our frontline service industries, the simple presence of someone who is a positive case does not mean that a significant exposure has occurred. So for really what constitutes a close contact is someone who is within 6 feet of you for 15 minutes or more, typically. And so that is something we're always looking at. We ask people when they're out and about to use facial coverings and do all of the distancing and everything because we know each of those measures adds to the safety of any encounter we have out in public. But again, that is the bar we use, is are we concerned about the presence of close contacts who may not be aware and that we cannot identify through our investigation? Mm-hmm.
The Redwood News asks, when it comes to the new tier system and moving either up or down a level, you've talked about how that is determined by the 7-day case rate and 7-day positivity rate. Does the means of transmission for cases play into that at all? Would more cases of community transmission versus contact to a known case have more of an impact on our placement in the tier system, or is means of transmission a non-factor?
That's a really good question. You know, the state system focuses on these two parameters, although in the fine print, you will notice in the materials that they also talk about other concerns that can have an impact on how things move. For instance, what's our hospital capacity? What is happening in terms of our testing rates? Are we getting people tested? Are we getting all segments of our community tested that need testing? So there are other things that can impact the decisions. When I look at this question, I appreciate the fact that there's an understanding that community transmission is particularly worrisome because it really connotes the presence of cases we can't relate to anyone else and speaks to the underlying level of disease in our community. So when I look at the data, I'm more concerned if I'm seeing a lot of community transmission. If we have an instance where we have an outbreak in a particular setting that impacts our case numbers significantly, but leaves everything else okay, that's something we would be discussing with the state at the time we're making these decisions. But how that would play out really will depend on the circumstances.
The Time Standard asks, an employee who tested positive for COVID-19 who worked at a local business was self-isolating and, quote, has taken the medicine required by public health, end quote, a fellow employee told us. Is public health requiring any people who test positive to take measures beyond self-isolating, including taking medication? And if so, what are those measures and medications?
No. We don't treat patients who we have in isolation or quarantine. That is not our role. And so, no. I don't know what the intent of the statement was. Perhaps it just meant having to be in isolation or quarantine, being the medicine per se. But no, we don't do that.
The HSU Lumberjack asks, what is your final stance on HSU's campus opening in less than a week?
Well, I understand that that's the schedule, and I'm really appreciative of the fact that HSU has been working with us jointly on the testing and getting that done to help increase the ability to open more safely and the measures that they're putting in place on campus. So we will be standing by and ready to assist as needed once students are back on campus.
The North Coast News asks, any last words for those who say the virus doesn't exist?
Well, again, I'm a person of science, and I don't think there's really any debate on this. And I would argue that the 186,000 people or so who have died and whose families are mourning them would also say that there really isn't much ground to stand on there.
The North Coast News asks, with the Optum contract set to expire, what is the alternative being planned, and will it be in place before the end of this month?
Well, it's interesting. The testing landscape is moving really quickly, and the state announced just last week the plans to set up a really massive state laboratory. There may actually be 2 sites, so that's going to increase capacity within the state for testing. We shall see. There is also discussion at the state level about Optum-like types of entities that may still be part of the plan. So we're watching all of that. At the same time, as I mentioned earlier, we are really creating an alternative for our own area and moving that forward in anticipation. So I think what we will likely see is that Optum or some variant of that may still be present in October. We don't know that yet. There may actually, in early October, be another state alternative in terms of a large lab that can be used if needed. And we are hoping that the alternative we construct will be ready this fall as well. So we're just covering all our bases at this point so we can ensure adequate testing for everyone.
Thank you, Dr. Frankovich.
Thank you.